Welcome to Golf and Muscle Function. And I just want to talk about what muscles do in a golf swing. So here you'll have seen a rough approximation of a golf swing. And so we see a little bit of leg turn through. But essentially you see all the motions that are going to happen during that swing. And our point here is to look at what happens and how the muscles perform, and then consider then how we might train across the body as we get this golfer that we want to condition to hit the ball further or to be able to keep form as they get more tired. So you'll notice that although at the start of the movement, when we come back to the start, there will be just a little bit of concentric action. So both arms start to move over to the right and start to rotate, and so there's some concentric action that must occur to make this sort of first part happen. But then once that's happened, there's a bend in the knees, and as the bend in the knees happens and the arms turn, this is all being created as sort of reactive motion. So as the hands turn, the foot collapses, the pelvis moves, the knee bends, and as we come round, the majority of the muscles now are not contracting to get shorter, but the sort of muscles are lengthening with momentum or shortening through a change in position of the joints caused by this movement of the arms. And so if we look at the key muscles that we're asked to strengthen in golf, then bear in mind both feet would usually stay still, and it's just a result of this program that they don't quite on the left hip. But what would happen is, as the arms come round, we'd start to look at the body thinking about decelerating. And so we'd see in at the hips, we'd see an adduction and a internal rotation and an extension starting to happen. And so as we keep going round, you'll see that in the abdominals, you see an extension and a rotation and a lateral flexion happening. And you can see that you would see that the left hip starts to drop. So you get a pull on the left side with a rotation with an extension. So you have obliques involved, rectus abdominal involved. Everything's sort of stretching across to slow that rib cage getting away from the thoracic. The rib cage getting away from the pelvis, and so as the thoracic gets driven around the corner. So what we're trying to make here is, as everything lengthens, it then decides to shorten. And so on this movement, if we just look at the wrap round, what we're doing is, initially we might concentrically contract, and so you might say that externally rotating the shoulder becomes important. Grip strength is important. Internally rotating the left shoulder, that all starts to kick off the movement, and maybe sort of like a pulling of the right shoulder back with a pushing of the left shoulder forward. That's what kicks off this motion just here. Then once we've done that, then everything's now in flight, and so the concentric kicks out and the eccentrics kick in. So now if we go up to the top end of the range, at this top end of the range, look, that's where we get the most sort of deceleration happening. And so you can see that the right glute will be in full sort of stretch in the frontal plane and possibly in the transverse, but will be allowed more range through the extension through the sagittal plane. You can see on the left side you'll get some abduction at the hip, but you'll get some abduction at the knee also, and so you might start to think about how massive a frontal plane motion this is for the adductors, especially as you add in some sort of lateral slide as well. So you get the adductors, the hip flexors, the hip extenders, but essentially the muscles that sit laterally and medially around the hips, they're going to be the ones that are feeling this stretch. And so as you move up the body, you've obviously got the abdominals, you've got the right pec, you've got the left lat, all working together. You're stretching through the right side of the trap. If you look further down the chain, you're loading off of the left foot, so you have perineal reaction, you have soleus action going on there too, all to sort of lengthen and take this movement. The right leg should be pretty stationary, so the majority of the work's happening at the hip, and there will be some carry on over to the foot, and so the foot will start to feel a little bit of this sort of wind up, and so all this motion into this position will be giving you the loading that will turn into the next motion. Now the first thing to move on the next motion would be at the hip, so the hip would come back across and then the arms would fly through, and then you have the same idea on the other side. You have that big stretch to decelerate, but this time you're not decelerating to create another force, you're decelerating to stop that motion come through. So you notice that the motion drives the right leg through, and so very much the backswing relies on that left side hip in the transverse and frontal plane, and so probably you're looking at glute medius, you're looking at TFL, you're looking at anything the body can grasp to sort of slow you down and get you into that one-legged position where the foot will be going into sort of more of a loaded, firm position. And my point here for both of these movements, so looking at the backswing and then taking it through to the follow-through, is that the majority of the motion in here is about lengthening, not shortening. Now, when we go on to look at sort of more of the sequencing of the bones, you'll also notice that from this position, the hips will come through first. And so you'll get a secondary load through the abdominals, and that'll pull the body into the correct sequence to bring the arms round. What I think is really important is looking at height change. And so, although that is coming from a squat out, this is coming from a squat out, the squat will be really partial in both. And so a lot of the exercises we see related to muscles in golf require quite a big vertical component. Whereas what we're seeing here is the left leg goes through quite a lot of load, quite a lot of abduction to adducted at the knee, goes from abducted to adducting and internally rotating more at the left hip. The foot goes from flattening to tightening up as a left foot, whereas the right hip goes through a lot less range to load and then kind of becomes a passenger as you come through with the clubs. And so the role of the right hip is probably quite small, certainly with the right foot as well, other than a more conscious decision to keep it still. If you look at the abdominals and you look at all the way up into the thoracic and the back and the chest, then their range is a little bit greater. But the majority of the things that are going on are transverse plane. They're rotational. And so this is a big rotational movement, even though in some aspects you want to be holding on to the rotation. So such as the right hip, you want to be holding away from the rotation, the lateral and sort of the lateral motion, the adduction. In the abdominals, you want to be encouraging that rotation, but at the same time there needs to be some lateral flexion. Where you can't see well from that angle is the right shoulder needs to be up, the left shoulder needs to be coming down. And so the importance for us when we're conditioning is then to start to say, well, the better our golfer, the closer to these movements we want to be to emphasize the muscle we're after. And so as we get to program design, we'll get more into, well, what's this muscle doing and how do we condition that one specifically. But if we step back and say, well, when we see a golfer, what do they ask for most? Well, one of the things they ask for is core strength. And if you look at the core, it's pretty important that you've got the rotation with lateral flexion available, because if you don't have, then that muscle won't be able to slow down at end range. So what we really want is, can we get that rotation and lateral flexion to happen in that midsection over that range? Can we get that? Can we have a muscle that will allow that much motion to allow the sequencing of the bones in a way that we need to get the golf swing within the range that we want? And this is the importance. So if we go to some of the exercises you might see advocated for golf, for a start, one of them might be that you work on core strength and you look at perhaps Pilates style moves or more core stability style moves, where they're looking to keep a neutral spine, and they're looking to hold the motion in their abdominals so that there's no movement while the arms move around. Well, if you look at this, we want quite a large range in those shoulders. And the only way we're going to get the large range in the shoulders and the rotation of the club is if we allow the abdominals to lengthen across 3 planes and sort of give us that resistance that will fling back into a powerful move through the swing. So that's what we're looking at here with these this motion. At the same time, we need motion available in the traps across things like scalenes and sternocleidomastoid up in the neck, just to allow that head to stay still. And we also need to make sure that as we get our golfer to make these motions, that they can get out of them. So at this place, we want to see that the hips can shift first after this point. So what would make the hip shift left, and it would be a combination of what's happening at the right hip and sort of initially how the right hip comes through, then how the shoulders can then be driven straight after. So we might expect a little shift of the hip to the left, and then as that happens, we'd expect the abdominals to then pull the arms through, and then that would pull the whole body and torso across and around that left glute. And so then as you get around that left glute, all the power and momentum will be fine, and that'll allow this fluid golf club motion. And that's kind of our goal. We're not looking for changes in speed. We're not looking for like an aggressive push. We're looking for this big elastic motion across the body and then spinning out to another elastic motion the other side. And so the whole point of sort of giving you this muscle function of golf is to say, well, you need to look at everything in the body. If there's too much movement at the foot, if you've got too much range on the left side, not enough on the right, then that might require you to move a lot more in the thoracic, maybe requiring you to bend your knee more and turn your pelvis more. If you don't have range in the upper body, you're also going to have to do the same sort of space of movement. And when we get into the breaking down the golf movement, when you start to look at that bone by bone and joint by joint, you'll start to see that actually there's quite a significance to the sequencing of the muscles being lengthened, and then the muscles shortening happens in a slightly different sequence to how you'd expect if you thought 1 would follow 2, 2 would follow 3, and then on the way back 3 would start the change, 2 then 1. And an example is the hips seem to load first, unload first, and provide that motor to pull everything else through, and they kind of load the spring. So it's very important to be able to focus on the hips and say, do they go where I need them to go? Is that a muscular thing that's either preventing them, or is that a muscular thing where I don't get enough recoil to come through? As we get into the muscles later on, we might notice that the client decides that they become more, they're more glute dominant at getting out of places. And although you don't often hear that, a glute dominance in this specific movement might mean that the client moves a lot more in the sagittal plane, and that causes a movement of the club and the club head, and that could be detrimental to them hitting the ball. So although we won't treat the muscles as a separate component of how we train this client, it may be that we're told by another golf pro, this is what muscles need working on in this client, and so we have to go and work on that. Maybe we'll get told by by the individual or the physical therapist that they need to work on a certain area of their body, a certain muscle in their body. What we'll need to do is interpret that to, well, how does that muscle lengthen? So as we get further into this, we'll look at muscles and their role in this sport. If you look at just for now at the muscles, we're saying now the muscles that take you from flexion to extension, those muscles aren't going through big ranges. But the muscles that slow down rotation, they're doing a lot of work. And so the muscles that work in the frontal plane are providing a lot of power. They're not hitting end ranges, and especially around the hips, they're doing a lot to pull you across left or pull you across right. And so although we've not gone muscle by muscle and said, well, what's the significance there? We're already starting to say, well, there's a lot of things in here we're going to need to look at. And as you can see, it's going to be a transverse plane sport. And certainly this is not about holding the sagittal plane still. This is going to be about how do we decelerate transverse plane? How do we use the frontal plane to give us that pop of power? How do we allow the sagittal plane to not become dominant, but to also allow us enough of the motion required to get through that arc? And so they'll be the questions you ask as you get through this this course.